can introduce myself. Hi, everyone. I'm Dr. Lissa Rankin. I'm trained as an OBGYN, and I left the hospital in 2007 after pretty intolerable moral injury with the disparity between what drew me to go to medical school and the actual system that I was functioning within. I was very disillusioned and, struggling with physical and mental health issues. And I had a baby, and my father died, and my brother was in the ICU with liver failure as a side effect of an antibiotic he was taking for a sinus infection. And my baby's father cut two fingers off his left hand with a table saw, and my dog died. And all this happened in a really short period of time. And the consequence of that, sort of the PTSD of my medical education and medical life, sort of culminated in me leaving that job. And it took me several more years. I was very lucky to have the influence of Dr. Rachel Naomi Remen, who was a Stanford pediatrician who got called to Esalen Institute in the 1960s and was exposed to all the human potential movement uh, changes in medicine that were happening at that time. And her influence on me was really profound. She runs a circle of doctors that includes our former Surgeon General, Vivek Murthy. And so that really helped me kind of get back on my feet to find out how do I and how do I not want to interface with the medical world and the medical institution. So I've since written 8 books, the latest of which is with my partner, Jeffrey Rediger. Both of us have been studying radical remission, people who are cured from incurable illnesses without the kind of conventional medicine that would explain their cure. And I wrote about that in 2 of my books, Mind Over Medicine, which is the one we're mostly going to be talking about today, I think, which has been turned into 4 TEDx talks and a PBS special. And then the sequel, Sacred Medicine, for which I traveled all over the world working with, shamans in Peru and Qigong masters from China and faith healers and energy healers. And that ultimately led me into the trauma-informed medicine world, the world of cutting-edge trauma therapies, most notably internal family systems. So I've been teaching about internal family systems as adjunctive medical treatment for people with, chronic illness or terminal diagnoses and things like that. I started the Whole Health Medicine Institute, where I've been training doctors for over 10 years in the things that we didn't learn in medical school that I think are important for medical people to understand. And I've also been training therapists to work in the medical field with the chronically ill in order to, help them see the body as a trailhead for deeper exploration and self-inquiry around the traumas that might be underlying chronic or life-threatening medical illnesses. So that's a little bit. I've also started a nonprofit because I'm really interested in health equity, and I don't want sort of um, mind body medicine interventions, wellness interventions, trauma therapy, spiritual healing. I don't want any of those things to be a luxury good only for privileged elites. So we started a nonprofit called Heal at Last, where we're trying to bring sort of a group delivery model, kind of like 12-step, to people who are chronically ill and have a trauma history and are sort of motivated to do that deep dive work, but can't necessarily afford one-on-one therapy. So we just got our first grant for that, and we're working hard to try to bring that in a safe enough way in a group delivery model that'll be sort of by donation only for anybody who's up for that deep dive. So I'm delighted to be here. Thank you.
Great. Well, we're glad to have you, and thank you for sharing all of your extensive background, Lissa. So, actually, you used a term that I would like to have defined, just so just so the audience knows what it means. Internal family systems. What does that mean?
Yeah, thank you. IFS is a cutting edge trauma healing modality developed by Dick Schwartz. It's been around for over 30 years. It's an evidence-based model, and it's based on the idea that we all have we're not like a unified self, that we all have a lot of parts. And we all know that because every single one of us has had a, New Year's resolution, a part that wants to improve us, like a self-improvement part, a self-help part that wants us to do better. And then we have the part that breaks the New Year's resolution. And then we have the part that comes in and shames us and tells us we have no willpower, we have no discipline, we're a piece of crap. And then the cycle sort of continues. So all of us have have those kinds of polarizations inside. In fact, this afternoon I'm teaching a class for people who are thinking about publishing a book about how to talk to the parts that want to publish your book, and then how to also talk to the parts that don't want to publish your book, so that you can make more decisions that are led more by the part of you that's not a part that IFS calls self with a capital S. It's like the divine spark, the core aspect of our being that can't be damaged by trauma. And those parts in IFS are sort of divided into protector parts and what they call sort of the vulnerable inner children or exiles. So there's sort of the survival strategies that we learn to get through childhood. And they can be really helpful parts like time management parts, financial manager parts, parts that keep track of our to-do list, parts that make sure that I get the answers right when you ask me questions. Um, and they're all trying to prevent us from feeling the pain of unresolved trauma. And then we have the parts that we don't like so much, the less socially acceptable parts, the parts that, use addiction or, busyaholicness or lash out at the people that we love or, act out narcissistic parts or get hospitalized or demonized or put in rehab or medicated, parts that we don't like, and usually other people don't necessarily like them either. And those parts, we call those sort of reactive firefighter parts. They're trying to put out the flames of emotion that come up from that unresolved trauma. So I'm particularly interested in the parts that use the body to get our attention because we've tried everything else. We've tried outrunning it. We've tried addictions. We've tried spiritual bypassing and meditation and things to make it go away. And the body is keeping the score, as Bessel van der Kolk says. So because I'm a medical doctor, that's my particular passion.
Thank you. So you just mentioned, you're doing a presentation about how to talk to the various parts, the parts that want to write the book in this example, and the parts that don't want to write the book. Can you give us an example of how you would go about talking to those different parts of yourself in order to
Well,
accomplish what you want to accomplish?
yeah, absolutely. My partner and I went through a struggle in our relationship, and we actually did an IFS session with the founder, Dick Schwartz. And he used this incredible model because my partner wasn't sure he wanted to stay in the relationship with me. And so he was like, okay, fine. Let's get all the parts that want to stay in a relationship with Lissa on one side of a conference table. And then let's get the other parts that don't want to stay in a relationship with Lissa on the other side of the conference table. And, you are going to be the sort of mediator at the head of the table in self, listening and taking guidance from the different parts to help mediate, just like we would in a family therapy session where the therapist would be the mediator for the external family, right? In the internal family, that conference table can be really, really, really helpful, right? So, for example, a lot of the work that I do with chronically ill patients, a lot of people who have chronic illness, they have really strong parts that want to get better, right? They are motivated. They're reading all the books. They're taking this conference. They're reading Mind Over Medicine and Sacred Medicine. And my partner, Jeffrey Rediger, wrote his book Cured about all the 17 years of research on radical remission. They're improving their diet. They're listening to all the amazing people talking about, nutrient density. They're working out with their personal trainer. They're, going to the doctor and getting the best conventional medical care. And they're also seeing their alternative healthcare practitioners and their chiropractor and their nutritionist and going to yoga and meditating. And those were the population of people that were some of the sickest people I'd ever met when I first moved to Marin County and started my integrative medicine practice here. And so with those patients, I came to realize that there were these really motivated protector parts that were working very hard to get better. And often they didn't know the parts on the other side of the conference table that maybe didn't want them to get better. And so a lot of the work in Mind Over Medicine is how do we get to know those parts that, for one reason or another, they're not on board for getting rid of the illness that maybe is giving them a really good reason not to go to their toxic job where their narcissistic boss is has unrealistic demands of them, and instead they're getting a disability check, or not to deal with the abusive stepmom who gives them a migraine every time they're together, or not to pursue a dream, or I mean, there's a variety of unintentional and unconscious parts that can play in that may not even have a very strong will to live because of trauma, for example. So part of how we do that is we just get the parts, we sort of get to know them all. We work with the protector parts, especially the parts that are either trying too hard or not trying enough to achieve whatever goal it is we might be thinking about, or make a decision that we're confused about. And we make the assumption that they all are trying to help us, that they all have good intentions, and become intimate with them. Like, how do they think they're trying to help us? If a part is giving me a stomach ache when my housemate of 13 years is leaving tomorrow. We've lived together and raised a child together. And my daughter, I have an empty nest, so she's going back to be with her nieces and nephews. So I woke up with a stomach ache. It's like, oh, okay. If I'm focused on my stomach ache, then I'm not feeling my grief that a really good friend that has been part of my family is leaving tomorrow. And even as I say that, I feel the emotions of that. Um, and then if I can allow myself to be with the part that's actually grieving and has a right to grieve, then maybe my stomach doesn't have to try to distract me from that feeling, because if I bring in that loving self energy, that inner healer, that inner therapist, that reparenting part, that divine spark that we all have, to be with the part that's sad and grieving, then I may not need my body to try to take me out and distract me. And that's certainly not saying that all physical symptoms are related to trauma, or that that they're all related to suppressed emotions or anything. I might have a stomach ache because I ate poisoned food yesterday. But we often, what I find, and I've been doing this work now since 2009, working with sick patients and doctors, that almost always, even if there's another contributing factor, genetic factors, environmental factors, dietary factors, almost always, if we ask the question and we ask the part that, any part that might be using the body, why are you here? Why, what is it that you want from me? What is the message that you're trying to deliver to me? What am I not paying attention to? Or what feeling do you need me to feel? Is there something from the past that, that might be coming up? And maybe if you want, we can do a little experiential at some point, because it's easier to show it than to talk about it. But it can be
What,
very,
what's an experiential?
oh, I was just saying it's easier to demonstrate IFS than it is to talk about it. So
Okay,
if at some point you want me to just lead the people listening through an experience.
okay. You know what, we'll save that to the
Yeah.
end. So we're gonna do about 90 minutes, and then we can do that in the last 30 minutes.
Okay,
That'd be
great.
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 So what is the core philosophy behind your book, Mind Over Medicine: Scientific Proof That You Can Heal Yourself?
Well, in that book, again, I wrote that book right after I moved to Marin County, and which, for any of you who know Marin County in the San Francisco Bay Area, it's full of health nuts. And as a doctor, I had been working in the inner city of Chicago. I worked with Somali refugees on the San Diego Mexican border. I'd been working with very high risk populations in public health. And, many of them were very sick. But the story that I told myself was, well, they're very sick because of all of these social determinants of health. They don't have good access to medical care. Their diets are terrible. They have poverty issues. They're in violent neighborhoods, they're unsafe, their nervous systems are dysregulated, all of this. And then I came to Marin County, and like I said, these people were doing everything right. And I did not understand. And they had seen everybody. They'd been to Stanford and UCSF and like all these amazing health practitioners. They had charts this fat, they had 10 diagnoses, and these were young people. And so I redid my intake form. I created this 10-page form that was basically a comprehensive trauma screen, in addition to a medical screen and a health screen in general. And I started asking them, really probing questions like, what does your body need in order to heal? Or what would it take for you to live a life your body would love? And they would almost instantly dissolve into tears. And the answers that they would say would surprise themselves. They would say things like, I have to get out of my abusive marriage. I've got to put my mother-in-law in a nursing home. She's making the whole family crazy. I need to quit my job and I have no idea how I'll pay the bills if I do. I I meant to go to art school, but instead I went to law school and I feel like I have this song in me unsung and I have to find a way to sing my song. Um, and sometimes it was more practical things like I have to get in therapy and deal with the childhood abuse that I just haven't looked at. But there was some clarity, and in IFS we would say self comes in. There was some clarity that would come in, and they would say something that they already knew, but that they were kind of pressing it down. It was like, because then instantly other parts would come in and say, but I can't do that. And then they would, list the practical reasons why that would be a challenge. And so then we would start working with those polarizations inside, the parts that know what you need to do in order to not have your body be taking the chronic nervous system dysregulation of whatever it is that's at the root cause. And then the parts that are really legitimately frightened to do that. And so mind over medicine for me was, I wasn't trying to reproduce all of the amazing health advice out there. This book was not about nutrition. It's not about exercise. It's not about epigenetics. It's not about all those. Those things are really important. But I was more interested, we know that chronic inflammation is at the root of almost every illness and exacerbates any other illnesses that it didn't cause. And, all those other factors affect chronic inflammation sort of from the outside. And I was much more interested in all the other like relational determinants of health. Nobody really talks about that, but all of the different factors of our lives. I created a model called the whole health cairn that was sort of like all of the ways that our work impacts our health, that our relationships impact our health, that our creativity impacts our health, that our spirituality impacts our health, that our financial lives impact our health, that our physical environment and the home that we live in, the neighborhoods we live in, the communities we're part of impact our health. That we're impacted by our mental health, by our traumas, all of these, and we don't talk about these things, and there's scientific data. So originally, Mind Over Medicine was going to be all the things that science can prove that are not the traditional health advice that can significantly impact your health. And then I was bumping into all of these mystery stories of people who had had really unexpected cures from things that there was no science to back up. And I was originally going to make that part two of Mind Over Medicine, but that then became Sacred Medicine. All of these people that have these sort of mystery stories of cures from energy healers and shamanic interventions and trauma therapy sessions and things like that. So that ended up becoming Sacred Medicine. So Mind Over Medicine was really, it was kind of embraced a lot by the alternative and natural medicine world, which I wasn't part of at all, and I really didn't know anything about. I'm very conventionally trained at Duke and Northwestern, and my dad was a doctor. Um, but I was really curious about all the science that we weren't taught in our medical training about things like the placebo effect and the nocebo effect and the impact of loneliness, all of the scientific data showing the impact of loneliness on health versus how health promoting it is to be in healthy relationships and healthy communities, like the story of Rosetto, Pennsylvania that I told in Mind Over Medicine. And then I wanted it to be really actionable. So the last section in Mind Over Medicine is what I call the 6 steps to healing yourself. And that's the model that I've been training to doctors for 10 years now and patients of how to sort of work through those 6 steps for any medical or mental health condition in a way where you can be proactive and take agency about the things you do have control over, with an acknowledgement that there are sort of social determinants of health that may be out of our control, like poverty and systemic racism and, um, authoritarian governments, things like that.
Great, thank you. So you described stress as something not what you think stress is. How would you define stress in the context of your work?
Well, especially when I started doing this work and after I had just come out of the hospital and I moved to very high functioning Marin County where, you've got a lot of biotech people and highly successful people. And they almost wore stress like a badge of honor. Like, I'm stressed, therefore I'm busy, therefore I'm doing something in the world. And it was almost something that people bragged about. But what a lot of people don't realize is that when we talk about stress, what we're really talking about is activation of the nervous system, right? This is fight or flight for the sympathetic nervous system, or freeze and fawn for the kind of drop dead part of the dorsal vagal parasympathetic nervous system, or the fawn, which is a bit of a combination of both, where trauma survivors, especially people with relational trauma, will people please and overgive and over caretake and self neglect and burn themselves out and get sick. My newest book is called Relation Sick. So that's how people get relation sick, is the fawning pattern. And so, we know that the body's natural self-repair mechanisms, of which we have many, we're all exposed to cancer every day. We all are exposed to pathogens that we fight off. Our bodies break down. We have proteins that get denatured, and we have systems in place in the body to naturally fight those things off until at some point we age and the body can't continue to self-repair. And that's a normal part of, you know, being a 90-year-old who is going to die. But for people who are sick in their 30s, their 40s, their 50s, that's almost always a sign that something has broken down, unless we're looking at sort of genetic conditions, that something has broken down, that we are not able to fight off whatever has been coming up. And that is very often the result of chronic nervous system dysregulation. So stress responses in the body that activate, the hypothalamus, which activates the pituitary gland, which activates the adrenal gland, which spits out cortisol, epinephrine, norepinephrine. And then this just causes great wear and tear on all of our organ systems as a result of the nervous system that's firing stress. So I feel strongly we need to sort of see stress for what it is, which is usually trauma. Why are we doing that? Why are we burning ourselves? Why are we burning the candle at both ends? That's almost always a trauma response. If we're obviously, there are stressors we don't have control over, as I said, and we can use strategies to mitigate stress. We can learn mindfulness and do our IFS work and go for walks in nature and forest bathing. And, there's lots of strategies for trying to bring the nervous system back into a more regulated state, including a lot of the data that I wrote about in Mind Over Medicine with Herbert Benson about the relaxation response. But this glorification of stress, I think we need to think of it as trauma. And a lot of us don't want to think about it as trauma because we don't want to go and do that deeper work.
So you talked about the people who wear it as, stress as a badge of honor. How do you change their perspective, right? Because in order for them to even do that, they don't even realize there's work to be done because they think it's a good thing. So how do you get to those people and have them realize how toxic it is to their own health and well-being, and where their drive to wear stress as an honor or as a badge may come from?
Well, again, they usually come to me because they've had a physical breakdown or a mental health breakdown. It's not sustainable. We can't, when we're young, we can sustain that, nervous system dysregulation more readily, but it's wear and tear on the body. And so the older we get, the harder it is for our bodies to fight off that chronic nervous system dysregulation that leads to immune system dysfunction, that leads to chronic inflammation, that impacts the microbiome, that affects our epigenetic influences and how our genes express and regulate themselves, and ultimately interferes with the natural self-repair. So again, I wish I could get to people before the body breaks down, right? Because most of us we have warning signs, we have whispers from our thoughts, from our body, from our emotions, and we override those until there's some sort of collapse. And so, like I said, that's usually when I see people, and then they're much more motivated to have this conversation. Before that, it's very hard. I mean, I also work with medical students and talk about burning the candle at both ends in the name of productivity, and I'm a savior. I'm going to save the world, They don't really realize the grandiosity and sort of the narcissism that's implied in trying to acquire that power to, cure the body. And It's very destructive for doctors. We have very high rates of mental illness, addiction, physical illness. And one of the reasons I left is I was taking 7 medications that my doctors told me I would be dependent on for the rest of my life by the time I was 35 as a medical doctor. And within 2 years of leaving, I was off all of them. And none of them were psych meds. Probably should have been on psych meds, but I wasn't. And I'm not anti-psych meds. I'm not anti-medication at all. But those were lifestyle illnesses that I was acquiring, and they were reversible at that young age when there wasn't too much wear and tear on my body already. So I wish I could get through to sort of people that are still in that driven, striving. That's a part, right? That's a manager part. It's trying to prevent danger. It's trying to help us succeed. It's trying to make sure we fill up our bank accounts. It's trying to get us status and make us feel important and help us fulfill our callings and some of these really good things. But usually, striving parts like that are develop early in childhood, often from the firstborn, the parentified child, the one that had to take care of either mom and dad because mom and dad weren't very functional as mom and dad, or had to take care of the other siblings, took on responsibilities way too early, and never really got to be a kid. So when we do that work with people that are in that kind of stress, that's very often what we find is that, they haven't gone back to deal with the trauma of not, inadequate parenting that put them in situations where they had to carry too much responsibility. And now they've developed an entire identity around being the savior, the hero, the rescuer, the high achiever, the CEO, the doctor, the lawyer, the celebrity, the wellness influencer, whatever.
So in talking to you in this brief time, and you even alluded to earlier, the fact that you have a background as a medical doctor kind of informs how you see things. How do you think that had, like, what benefit does that give you as a practitioner of what you do compared to people who don't have that background?
Well, first of all, I know all the science. That's why I'm not anti-medicine. I'm not anti-science. I understand how to read and interpret science. I'm not vulnerable to conspiracy theories because I know how to read the data and actually do, we had journal clubs at Northwestern like teaching us how to tell fake science from real science. So I think that's really important. I have the critical thinking skills and the skepticism. Um, and but I didn't have the openness to other ideas when I was in my medical training. It's definitely its own religion. Conventional medicine, especially in the more well-respected institutions, can be so dogmatic that it's like its own fundamentalist religion. And my father was like the priest of this fundamentalist religion for me. He was the black sheep of the family. All the other family members were pastors, Methodist ministers, and so he became sort of the pastor of this conventional medicine, and made fun of anything alternative, sort of mocked anything I was curious about. And I honestly don't believe I would have written Mind Over Medicine if it hadn't precipitated the crisis that included my father dying young at 60 years old of he had 2 cancers in 1 year after having MS, and was a really good example of kind of a lot of what I teach about now. He shouldn't have died at 60, but he wasn't he wasn't going to touch the trauma of his childhood. He grew up in Cuba during the revolution and was banished from the country, and it was just not something that he was going to talk about or touch in his life. So I feel a lot of compassion for anybody who's sort of like that. But losing him and losing that kind of oppressive dogma, and then being exposed to Rachel Naomi Remen and Esalen Institute and some of these places that were sort of the hotbeds of the early mind body medicine movement, it gave me a way to re-educate myself about the stuff that wasn't in medical training, because I really believe, it upsets me that there's such a polarization between conventional medicine and sort of natural or alternative medicine. I see them as medicines. They're all wonderful medicines in the world's medical toolbox. And, it's just a matter of discernment and trusting the patient to be able to understand which medicine works best when. In my book, Sacred Medicine, I wrote a whole list of what I called the paradoxes of healing because I just don't, yeah, yeah. Can I read a few of them?
Absolutely.
Yeah. You can heal yourself and you can't do it alone. Conventional medicine can save lives, and conventional medicine is the third highest cause of death in the US. That was before COVID. Keep an open mind and don't be so open your brains fall out. Be clear in your intention to heal and surrender attachment to outcomes. Trust your intuition and follow the science and apply critical thinking. Believe in magic and miracles and avoid indulging in magical thinking and denial. Be proactive about taking back your power and go with the flow. Your disease is not your fault, and your healing journey is your responsibility. Be guided by germ theory and terrain theory. Your thoughts influence reality, and your thoughts cannot control reality. Maximize self help and be willing to ask for help and rely on others. Fear can cause disease, and repressing and ignoring your fear can kill you. So you get the idea. There's a bunch of them.
Mm. All right. Thank
So I'm like, why do we have to divide into these camps that then polarize and smack talk each other? It's so disrespectful and it's so narcissistic on both sides. I see it on both sides. I see the narcissistic influences that are smack talking conventional medicine, and then I see the narcissistic doctors that are smack talking anything outside of the conventional bubble that I was sort of dogmatically raised in. So I've tried really hard to keep the good to keep the baby and throw out the bathwater of the sort of dogmatic materialist science that I was raised in, um, without going into the pseudoscience or being vulnerable to this sort of wishful thinking where people have pre-existing agendas and they're looking for bad science to validate their wishful thinking. So I'm all about reality-based medicine, with optimism and hope.
So you share concerns about being misunderstood, which I think is a good segue here. So what is the most crucial message you hope the audience takes away from your work?
Well, I kind of alluded to it earlier. When Mind Over Medicine came out, it was a New York Times bestseller. It sold hundreds of thousands of copies. It's in over 30 languages. It was on PBS, so it got a lot of attention. And, I had just kind of come out of my conventional medical world. I didn't know much about anything outside of that world other than what I was learning from my direct experience with patients who were having radical remissions, who were curing like heart disease, like their echocardiograms were proving um, congestive heart failure. Now congestive heart failure is gone as a result of autoimmune diseases, for example. I had no idea what was going on, and I was actively studying, spontaneous remission, reading all of the case studies of, over 3,000 case studies collected by the Institute of Noetic Sciences, written up in medical journals, what was happening. And I was very curious and, very interested in all of this. But then when my book came out, it's like somehow people interpreted this, or some people interpreted this book as, oh, Lissa is anti-medicine, or she's the champion of the We Hate Medicine Club. And that's never been true. And so I got a lot of pushback during the pandemic when I was like, lock and step with, vaccine guidelines, for example. I got vaccinated right away. I was the person in my small town that made sure all the elders could find their vaccinations. I was posting on social media. One of the books that I wrote, for example, had a foreword by Christiane Northrup. This was 2010, and she just became full on anti-COVID, anti-vax conspiracy theorist. And a lot of the people that I had known and respected kind of went that way. So I became sort of a spokesperson for, like I said, both camps. How do we approach the pandemic with concern for public health, concern for public health guidelines, also concern for mental health, concern for our kids and what happens when we don't let them go to school, concern for people's medical autonomy, concern for people's alternative views and ways that they might want to prepare their body to handle COVID better if they get it, and trying to bridge those gaps. And it was very difficult because if I went into any sort of alternative or natural medicine or talking about trauma as it related to susceptibility to COVID, I'd get attacked by the conventional medicine folks. And if I was promoting public health guidelines, I'd get attacked by the other folks, as if I somehow betrayed them by taking a public stand around that. So it was very confusing, but it was actually ultimately good for my career because I ended up attracting the people that are interested in people who are bridges, that are not in one camp or the other, but are willing to be truly integrative between conventional medicine, alternative and natural medicine, and trauma healing, spiritual healing.
Did that experience inform your future work, like where you want to go in what you're doing, or it's just sort of something that now you have an audience that's really more right sized for you or fitted better for you?
Well, it did. It definitely, especially because so many of the people in the sort of spiritual white people world went sort of alt-right, um, conspiracy theorist, Trump is a light worker. It definitely caused me, I started teaching during the pandemic. I taught 3 classes about spiritual bypassing recovery, like how we use spirituality to avoid feeling the overwhelm and the fear and just the terror of the uncertainty, the kind of uncertainty that was happening during the pandemic. So I have a lot of compassion for people that were sort of drawn to spiritual bypassing ideas or conspiracy theories as a way to not face the reality of what was happening. But I also see that that actually predisposes them to potentially being sicker. So I got really involved at that point in sort of bringing internal family systems into spiritual communities to help off ramp. Like we can keep the baby of spirituality, we can keep the beautiful practices, we can keep what's helping, and get rid of the sort of cultic indoctrination, the avoidance of trauma, the conflict avoidance, the avoidance of reality, these psychotic delusions sometimes that can go, that can break us from what's actually healthy. And it definitely, steered me more towards healing relational trauma as it relates to what improves our physical health. The current book, Relation Sick, is about unbalanced relationships and their impact on the body. When I say unbalanced, that can be, we call it level 1 relation sick, meaning, for example, if you're a caregiver of somebody who's very ill, you're going to be in an unbalanced relationship. You're going to be caretaking maybe more than you're receiving in a relationship like that, and nobody's at fault. You may have mixed neurotype couples, for example, where one person is higher functioning because of the way their nervous system operates, and somebody else might struggle to function at the same level because of a very different orientation of the nervous system. And again, nobody's at fault. There are beautiful qualities in people who have various disabilities or different abilities, but it can still impact the caregiver. And then at the most extreme, we have sort of level 2, the kind of classic narcissist codependent, and the level 3 being somebody who's a victim of coercive control, which is illegal in some countries and states, but not in most. And then level 4 being coercive control plus criminal activity, domestic abuse, embezzlement, fraud, con artists, cult leaders, things like that. So I'm very passionate about that, about how do we help people who are in recovery from oppressive or unbalanced relationships, cult survivors, people whose bodies have really taken a toll because they've been indoctrinated, and they've been suppressing their own needs, throwing their own parts under the bus, prioritizing somebody else's needs, um, you know, fawning, fawning somebody they've decided is, for whatever reason, more important. And at the core of that, I think of Paul Farmer's quote, which is, I always butcher it, but it's something like, the idea that some lives matter more is at the root of everything that's wrong with the world. So most relation sickness is based on the idea that somebody else matters more than yourself. And when, part of the treatment, we have like the 6 steps from fawning to freedom in the book. It won't be out until spring 2026, so I don't want to get people too excited about it yet, but I'm previewing it on Substack, so you can look at lissarankinmd.substack.com for people who are interested in hearing about that ahead of time. And also in a program I'm doing called Love School, we're sort of giving previews of that material. But beginning to turn that around is sort of walking that razor's edge. How do we get to know and become intimate and caretake our own parts that have been traumatized, or the survival strategies that we've used that have maybe outlived their usefulness, while also having empathy for others, while also being kind and caring for others, while not abandoning our relational responsibilities and walking that razor's edge. And for caretakers, that's so difficult. One of my closest friends, her husband has very early Alzheimer's. Her son has very severe autism. Um, and it's extremely difficult for her to take care of herself and still meet her familial responsibilities to two people who need 24/7 care. So, I'm really passionate about working with those people as well. It's not, and again, those are situations where nobody is to blame. So I'm not just saying, bad narcissists, like stop being codependent. Like there's a lot of messaging like that that I don't agree with at all. Narcissism is also a trauma symptom. It's a side effect of relational trauma and developmental trauma in childhood. So that whole what makes personality disorders is part of what I really care about, especially since I work with doctors and most of us were that sort of parentified child that learned to take on too much responsibility, but also sort of power hungry parts. We didn't want to be the nurses. We wanted to be the doctors. So I've had to work on
Incredible.
those parts in myself as well.
Thank you. So we often ask, or you often ask, what does your body need in order to heal? What are some of the most surprising or common answers you've received in to this question?
Well, we kind of talked about that early. Again, often what people would say right out of the gate is they would tell me some way in which they were not doing the thing they knew that they needed to do. So they were in denial. Like a part of them knew this is the thing that's missing in my life, or this is the thing that's out of alignment with my truth, or this is the way in which I'm out of integrity with myself. This is what's creating stress in my life. And yet these other parts that were concerned about practicalities, which, again, valid parts, we're talking them out of that. So, for example, I was working in Marin County, and I'm a gynecologist, so my patients were all women. And a lot of these women came in, and over, I heard the story of a person who was really a victim of narcissistic abuse. Um, they were being abused by their spouse, they were being abused by their mother, they were being abused by their boss, and this was completely normalized. And because there were a lot of perks, there's a lot of perks about being close to a narcissist, right? We often they are attractive, talented, have high social standing, successful, brilliant, genius, world leaders, visionaries. They bring a lot of good to the world, and it's difficult to give up those perks. And so just helping people get out of denial so that they could, and I'm not a person who says, oh, well, you have to get out of that relationship. No, absolutely. You have the power to change how you show up in a relationship. The minute you stop fawning and you start exercising good boundaries and you start standing up for yourself and you start requiring more reciprocity in your relationship, everything's going to change. Now, a relationship might end because of that, because somebody else might be absolutely uninterested in somebody who has been fawning and stops over accommodating, people pleasing, conflict avoidance, not calling people out, not holding people accountable for mistreatment or abuse, not taking advantage of the resources that they might have, including, law enforcement, restraining orders, social services. Um, but what I find over and over is that, assuming somebody is not victim of criminal abuse, coercive control, or crimes, things that are against the law. Most people who are sort of one up in relationships, and the one down is sick. They're open. They're often open. If they don't want to lose their partner, they don't want to lose their child, they don't want to lose So part of what we're teaching them how to do is how to figure out whether somebody is open to a shift in the relationship where we create more relational balance. And if they're not, then it's a very difficult situation for people because they might have to choose between continuing to be sick and staying in the relationship or leaving the relationship and hoping it improves the physiology in a way that allows those self-healing mechanisms to start to kick in. And I hate it when people are in that, terrible double bind, especially when there's kids involved and things like that. So like I said, I'm teaching people ways to figure that out. You know, how do you as the sick person exercise the power that you do have by being more assertive, by standing up for yourself, by getting to know your parts, by speaking on behalf of those parts, by pushing back, by setting boundaries, by putting consequences in place if those boundaries are overridden. A lot of people are like all or nothing in a relationship, and you absolutely don't have to do that. You can like dial the intimacy up or down, grant or withhold privileges depending on whether somebody's safe. And there are some really wonderful teachers out there that have been role models for me who talk very publicly about having been the person in a relationship whose partner required them to change, including Gabor Mate, Terry Real. Both of them sort of have long-term marriages where they speak openly about patriarchy and narcissism and power dynamics in relationship and how they impact the physical body and health. So I really respect the people that are willing to talk about that, without hiding it. So the more I think we can destigmatize that and, you know, um, talk openly about what we can do without dehumanizing anybody or deciding that somebody is just you know, untreatable. But I will say, I think people, coercive controllers and people who are willing to commit crimes against in their relationships, most of them are not willing to get treatment. So my advice to those people is get a lawyer, get out, get help, get in treatment, get safe, get better.
You presented in some of your presentations 6 steps to healing yourself. Could you briefly outline these steps?
Yeah, sure. I have a whole online program about it that you all can find at lissarankin.com. And I picked out my book because I wrote a revised edition in 2020. So the book came out in 2013. And I reorganized because I learned after 10 years of teaching doctors and working with sick patients. So this is the revised edition. And step one is believing that healing is possible. I wanted to put what is now step two first, and a lot of my patients convinced me that, like, the only reason they were even willing to get into the process of the 6 steps to healing yourself is because of the data about the placebo effect. Like, they were like, I have to have hope. I have to believe and have some evidence that my disease might be treatable. And so I tell people, for example, if you have a disease that someone has told you is incurable, Google search your diagnosis and spontaneous remission. And if there's even one case study, even if it's rare, if there's even one case study of somebody adequately diagnosed who was then provably cured, then the word incurable is inaccurate. You're not a statistic. It's important to know that there are rare but important examples of what my partner Jeff Rediger calls the Olympians of healing. These people who have these diseases that doctors believe are incurable, but for reasons that science has a hard time explaining, were actually cured without conventional medicine. And we're talking about everything from pancreatic cancer to HIV to heart disease to, autoimmune disorders to diabetes. So step two, and this was a big one for me, was connecting to and surrendering to what I now call self in IFS, right? So for those of you that have a relationship with something external, call it the universe, call it God, I call it my inner pilot light. That, in other words, this step is about helping you be proactive while letting the managers, the protector parts that might strive too hard towards health, It's like do what you can and let go of attachment to outcomes and trust the journey. The healing journey is going to be a transformational journey regardless of the outcome. And so trusting that the self inside knows what's going to be helpful for you way better than any of your parts, right? Your parts are usually young. They're usually parts that got their job working way too hard, striving, gathering information, whatever. Usually they're much younger than however old you are now. And if you can allow that wise, mature self to like slow everything down, self is in the pause. So a lot of doctors will pressure people, especially when they get a scary diagnosis. You got to make a decision right now. We got to get you into treatment tomorrow. It's like, take a breath, slow down, check in with the conference table, go inside, check in to see who's having opinions about all of this. It's usually a total mess inside after somebody gets a diagnosis. So trusting that there is a wise, mature adult inside that can help guide the process and allowing other medical professionals to be advisors, but not giving your power completely away. And then step three is surrounding yourself with healing support. I call it the healing roundtable. And I like that metaphor given to me by Susan Fox, an acupuncturist I used to work with at my integrated medicine center, because the healing roundtable is not a hierarchy, right? If there's any hierarchy, the patient is in charge. But very often we see sort of the doctor at the top of the hierarchy, the nurse under the doctor, for the doctor, the alternative medicine practitioners or the energy healers or the trauma therapists or the spiritual counselors, they might be way down at the bottom. That is not helpful for the patient. The patient needs to be responsible as best they can. And I'm very aware of the health equity issues around this, of being able to get a second opinion, interview their practitioners. I tell people to give your doctor this book and see if they're willing to participate in this process with you. Um, you know, and people have written to me over the years. Many, again, I train doctors in this process. Many doctors are absolutely willing to do this. Give it to your acupuncturist, give it to your chiropractor. Be on board to have these practitioners potentially communicating with each other and treating each other with respect, giving each other consult letters of what they recommend, and like don't talk smack about other practitioners. Like the patient is trying to bring in the people that they think are helpful. Their opinions may not always agree, and ultimately the patient is responsible for taking in that information, doing their own research, practicing their own discernment, and making the decisions that they want to make for themselves. Many of the people that we studied who had radical remissions, they were non-compliant. They had refused conventional medical treatment, not because necessarily they were in some law of attraction or manifestation or magical thinking, but because they had just decided they wanted to prioritize quality of life. If they were going to die anyway and treatment was just going to be palliative, then, they didn't want all those side effects from chemo or radiation or whatever. So we need to get rid of words like non-compliant. It's like I don't want patients to be compliant. I want them to have self-agency and make empowered decisions. And then step four is diagnosing the root cause of your illness. This is really the internal family systems work, the trauma healing work, the assessing your lifestyle work. What does your body need in order to heal? What is it going to take to live a life that your body would love? And in the book, I have a whole kind of screen based on the intake form that I used to give my patients of sort of figuring that out, giving people a sort of cheat sheet for diagnosing the root cause. What might that be? IFS is a simpler, easier practice, um, but we can use other ways of getting to that root cause. Some people know on their own without any facilitation. And then step five is what I call writing the prescription for yourself. And this is like a patient-led, self-guided prescription that might include aspects from all of the 10 stones in the whole healthcare. And it's like, what am I going to do to improve my work? What am I going to do to improve my relationships? How am I going to express myself creatively? What might be out of alignment in my sex life? Do I need to focus on my spirituality more? Do I need to clean up my finances? Like, do I need to get into treatment for my mental health issues or my traumas? In addition to, here's the things that my doctor's recommending that I'm gonna say yes to. Here's the things I'm gonna say no to. Here's the other health related, nutrition related, movement related, alternative medicine related, whatever. Here's my plan. And for a lot of people, that's overwhelming. So I tell people all you need to know actually is the next right step. And then once you've had the courage to take the next right step, then all you need to know is the next right step. So again, slowing that down for some people, different people have different ways of approaching this. Some people like having an entire 10-page action plan, and other people are absolutely overwhelmed by that. And then step 6 is something that I added after years of teaching this material, because in the beginning I was teaching this material at workshops and training doctors and therapists, and we'd go through this process as if they were the patient. And at the end, I would say, okay, let's pretend this is obviously there's no guarantees, but let's pretend that you did everything in your action plan to get, everything that you know that you should be doing. And let's pretend that it was guaranteed to give you a cure. How many of you are going to go home and do it? And about half of the people would raise their hand. And I was like, okay, wait, I want to talk to the people that didn't raise your hand. And just like the patients in my integrative medicine practice, it was those people who were speaking on behalf of those parts. They were like, but I can't do that. I'd lose my disability check. Then I'd have to go back to my horrible job. Well, my husband stopped beating me when I got sick. I don't want to get beaten again. They started basically speaking out about all of the parts that were actually getting something useful. If I got better, then I would have to, clean house again. And I hated cleaning house. And these these parts have sort of a crisis of imagination. They often don't realize, well, if your job is making you sick and you're getting a disability check, if you're cured, you could get a different job. And if your mother-in-law is the reason that you feel like you need this illness, like you can set really firm boundaries with your mother-in-law and maybe even not let her in the house or let your partner hang out with his mom and you don't have to. So a lot of that work was sort of negotiating, figuring out what those parts were about. So step 6 is treat your fears and resistance. And IFS is a good way to address those fears and resistance without suppressing them or demonizing them or bullying them. Like I see a lot of people in the wellness world, they just bully parts. Oh, there's nothing to fear but fear itself. Or like, no, your fears are valid. Like if you're worried about quitting your job because you don't know how to pay the rent, like that's valid. You need to be able to pay the rent. So, how do we negotiate with our internal family systems to problem solve? But when self is in charge, instead of the scared parts, we're much more creative. We're much more clear. We have a lot more confidence and we're able to problem solve in a more adult way rather than indulging those parts that are often much younger.
How can we be sure when we're trying to do this self work and we want to have self be in charge? How do we ensure it's self and not some other voice? And you're listening to it and it seems like it's working for you, and maybe it's, self's evil twin.
I love that you asked that question. It's a fantastic question. And in IFS, there are parts we call self-like parts. They're parts that masquerade as self, and they're really beautiful protector parts. I mean, I love my self-like parts. They have such good intentions. They really think they're helping. And the core difference is that self does not have an agenda. And self is not grandiose. So if, for example, you think you have the 411 to God and you are directly channeling the truth, guarantee you that's a self-like part. Nobody has the 411 to the truth. Like that is a part that is grandiose. And all the gurus try to convince people that they have that direct channel. And, you can ask them any yes or no question and they will give you the truth. That is definitely a part. That is not. Self is much more nuanced, again, because the goal is not to be in self all the time, but I like to think of it like a conductor of an orchestra, right? We have all these parts. They all think they're helping us. Some of them are helping us. Some of them are actually pretty destructive. They're maybe causing self-harm. They're sabotaging things. They're hurting other people, but their intentions are good. And I like to think of self as like taking in all that input, but it's like, and now we're bringing up the strings, and now we're going to tamp down the percussion. But now more cowbell, right? It's like um, conducting those parts rather than what we call blending in IFS, which is, the other metaphor I like to use is um, we all are a collection of like unruly inner children who like to try to hijack us and make our decisions. And we do much better if we put those unruly children in a school bus and we make sure self is driving the bus. So we're not gonna bully the children. We're not gonna demonize the children. We're gonna love the children, even if they're messy and throwing spitballs and, cussing and smoking a cigarette or whatever. We're gonna love them and get to know them and understand them, but we're not gonna let them drive the bus. So if a self-like part drives the bus, this is how we get cult leaders. This is how we get, really narcissistic influencers who are trying to exercise and abuse power with vulnerable, sick people. But it's also how we sort of delude ourselves. And I say this with full humility because I have nostalgia for the days where I thought had self in the lead. And it was really a self-like part. I've written about it in a book that I wrote about spiritual bypassing that I'm releasing on Substack called Love Bigger. And I say I have nostalgia for those spiritual bypassing days because it really worked. I felt really good. I felt really powerful. I felt like I was in control. I felt like I was getting spiritual guidance that was showing me the way. And the more I surrendered to this part, the more everything was clear and there was no ambiguity. It was really lovely. But that part definitely had an agenda to prevent me from actually dealing with the trauma of that perfect storm that I told you about. I had not addressed what caused me to leave the hospital in the first place. And when something else happened, another series of traumas happened in my personal life, those strategies suddenly stopped working overnight. And I think that's what happened for a lot of people during the pandemic. It's like their strategies just stopped working. And that was a gateway for many people, or we call it a trailhead in IFS. That was a gateway to starting to heal their trauma for those that were capable. And for those that weren't, they just ramped up the spiritual bypassing. So I love the question. Um, I'm not sure if my answer was grounded enough because it's I could teach a weekend workshop on the answer to that question.
Well, one
Did
thing I
that
will,
satisfy, or is there, sorry.
yes, I mean to say succinctly what you were saying is basically self is not full of itself, right? It's
No,
not
no, it's
okay.
not full of itself, and it also
Meaning, yeah,
it never bullies parts. It
right.
never, it does, anytime, one of the things that we do when we're doing IFS is um, if we're working with a part, for example, and a part comes up and says it's scared. It's scared to do this thing that we know is probably going to help us get better. Um, if a part comes in and doesn't like that part, it starts bullying that part. It starts spouting spiritual epithets to try to suppress it, using quotes from A Course in Miracles or a lot of these religious teachings and things like that to demonize fear. That's not self. Self is always, we call it the 8 C's. It's curious is often the first one that comes up. I'm curious about this part. I'm curious about this scared part. Um, I'm compassionate towards this part. I feel creative around this part. Maybe we can think of other problem solving strategies. I feel confident that we can handle letting this part bring its feelings without collapsing and being unable to function. Um, I'm clear in my decision making. I never remember all the 8 C's, but you can look them up. But
A
those
lot of
qualities, what?
I said it's a lot of C's to
Yeah,
remember.
yeah, yeah.
Um, could you give some examples of what you consider to be medicine beyond pharmaceuticals and surgery?
Well, I mean, we've talked already about my particular area of expertise and interest is treating trauma as medicine. I've taught multiple classes about IFS as medical treatment with the founder, Dick Schwartz, with Frank Anderson, who's an IFS lead trainer and Harvard trained psychiatrist. It's what I've been teaching to doctors for all of these years. Um, so that's one of the kinds of things. But then again, lifestyle issues, right? So I I'm also particularly passionate about relationships as medicine. And there's so much science, there's so much data around this. This is not woo, and this is not unevidence based. That we know that I'm part of how I work with people with the whole health care, and like all of those aspects in the whole health care can be medicine or poison for the body, right? So your work can be medicine if you're fulfilling yourself, you feel on purpose, there's meaning to your work, you feel like you're smack dab in the center of your calling. And there are so many case studies of people who faced a chronic or terminal illness, and they were like, well, if I'm going to die young, I'm going to do that thing that is really my calling. There's some just amazing stories out there about how embracing your calling has turned around people's medical illness. Right, but a toxic work environment where we're feeling oppressed, where we don't have autonomy, where we don't have agency, where we're being coercively controlled. There's so many Netflix documentaries out there about those kinds of work environments now. The Devil Wears Prada and the We Work and things like that. That's obviously going to be poison. And relationships are very much that way. When we have healthy, secure attachments, when we're embedded in community and we're not blended with a rugged individualist self help. I alone, myself, can heal myself. I'm not going to be vulnerable. I'm going to be stoic. I'm not going to let anybody else know that I need help. I'm not going to ask for what I need. I'm not even attuned to what I need. But I'm definitely not going to put myself out there and let other people take care of me. That's poisonous. But when we're, part of what is sometimes a big transformation for people who get sick, the caregiver gets sick, and then the caregiver has to receive care, or they're not going to do well. So it's often very triggering for caregivers when they are the vulnerable one, when they are the needy one, when they are the one that other people are going to have to take care of, and they feel really out of control a lot of the time. So doctors, we make the worst patients. We don't like being the patient.
So, in your work, you've identified loneliness as a major risk factor for health. What are some of the actionable steps individuals and communities can take to combat loneliness?
Well, I mean, anything can begin to do that. I think, especially during the pandemic, where it was like social isolation, 6 feet apart, like don't be part of a community because you might kill people. Like that's really hard. That was very, I think, comforting for people who had relational trauma and are actually frightened of other people and are really introverted already and had a tendency towards social isolation. Some of those people really enjoyed lockdown. But it's ultimately, that's usually, and I'm not saying that we don't have individual personalities with individual preferences. I'm an introvert. Um, Being out in public drains me. I recharge in nature by myself. Um, but it's also, I'm really lucky. I've lived 17 years in a small town in an area full of beautiful nature and the coast of California with a beautiful community. We're sort of geographically isolated from everyone else. So we need each other. So we're interdependent. So we rely on each other. We ask, if you run out of eggs, the closest grocery store is a half an hour away. You go to your neighbor and ask for eggs, which right now is asking a lot given the price of eggs. Um, so yeah, I think we're trying in my nonprofit Heal at Last. That's part of our goal is to get people off screens. I mean, screens are helpful. We can participate in health equity. We're trying to teach like health health improving relational life skills in a program I created called Love School that's for trauma survivors who are struggling in their relationships and they're interested in relation sickness and all of that. That's great. We can do it on Zoom. We can scholarship people if need be. We can, create more health equity by reaching 700 people at a time. But it does not replace sitting in a circle with 15 people, the way traditional 12-step programs would be, for example. So it has its flaws, but I'm inspired by the 12-step model because, 12-step groups, they're by donation only, they're peer led, they're not a luxury good. It's a way to get into community. Almost all of us can find something we could 12-step, but we're particularly interested in creating something similar to that for people who have physical issues related to trauma as a way to scale trauma healing with a health equity perspective, but also as a way to treat the loneliness that is very, very scientifically tied to medical illness, reduced longevity, and likewise, people who are embedded in healthy community who know that they have people they can rely on, who are not rugged individualists, who have help and support. They have been proven over and over again in like the Blue study evidence and Rosetto, Pennsylvania, and things that I've written about in Mind Over Medicine. Those people just live longer, and it makes sense. You think about a single mom trying to work and watch the kids all by herself, and she has no family and she has no friends, and she's so busy that she just can't even get out into the community. And you compare that to somebody embedded in a community where, you've got, I was so lucky I had four adults helping me raise my kid. um, in a whole community that when she wandered off and was found by the park rangers because she was on a grand adventure and was going to try to hitchhike to the ferry so she could go to China, like the whole neighborhood helped to protect my daughter when she got out and thought she was going to go on a grand adventure, right? So our nervous systems can be so much calmer when we're embedded in community. And we can do that in the smallest ways, right? I mean, you can get on Meetup and find like a guinea pig club, like any meeting of people who have a shared interest with you. I mean, even just going to concerts and being with music, I'm part of a dance community that was started by Gabrielle Roth with Five Rhythms. So like conscious dance where you're not drinking at a bar, but you're actually sober and moving in community with other people, going to yoga classes, going to like I said, it doesn't really matter what you do. My daughter took a permaculture class. Go plant trees. Go join with other people that are interested in gardening. Join a hiking group. We just joined a co-working space because I live at home and I'm a writer. So I'm pretty isolated now that my empty nest, my daughter is gone and my housemate is leaving. So I thought, well, I'm gonna participate in a co-working space where it's a members-based co-working space, so I'm getting to know the new people, so I can feel more of a sense of embeddedness.
So, what is one simple yet powerful action the audience can take today to begin integrating the principles of mind over medicine into their own lives?
Well, I mean, read Mind Over Medicine. You can take the 6 steps to healing yourself, but you can read about internal family systems. Dick Schwartz's book, No Bad Parts, is a great place to start. There's a chapter about IFS as it relates to internal family systems in sacred medicine. But at a really personal level, um, if you are struggling with a physical symptom or a medical illness or a disability of some sort, um, again, that invitation to just kind of come in with compassionate curiosity and just wondering if there are parts that are trying to protect you, that are using the body to get your attention, what is it that they're trying to communicate to you? And can you be open? Can you get other parts that might be scared of the answer or might be hesitant to do so? Can you get them to just give you space? And come in self to be with those parts, because again, we're not trying to push away any parts, but to come in from a place of open compassionate curiosity from that self energy inside of us, to just listen. And of course that requires slowing down, taking a pause, going inside, noticing what comes up in ourselves, feeling into our bodies in an embodied way, noticing a lot of times our parts are kind of constellated in some part of our body. So, obviously, if you have a physical symptom like a stomach ache, you might focus on the stomach. Um, it might be something more like grief about my housemate moving. I can see, where is my grief? Oh, my grief is in my heart. So we can put our attention on the part of our body where we feel that might be that way and just kind of notice, how do we feel towards those parts? And if there's anything other than curiosity, compassion, confidence, clarity, these 8 C's, if there's parts that don't like, if some of my parts don't like my stomach ache or they don't like my heartbreak, then we see if they can just give us a little bit of space. We acknowledge them. Thank you for chiming in and giving us your opinion, and just see if you can give a little bit of space so that we can stay open and curious. And just listen. What do these parts want for you? It's hard to think that an illness could have good intentions, right? Or that parts could use the body in a way that would have good intentions. But for example, in the rheumatoid arthritis study, um, that was done in the Internal Family Systems Research Department. They worked with people who had a lot of symptoms from their rheumatoid arthritis, and over, the message that they got was that their symptoms were related to this over caregiving, and that what they wanted was they wanted, they were crippling them in order to prevent them from continuing to overfunction. And then you can start to negotiate with those parts. Well, what if there was a way that I could volunteer to stop over functioning and give some of that responsibility back to other people and get more help helping meet the responsibilities of the people I'm caregiving or whatever? Would you be willing to take me out less? Would you be able to cripple me less? And so they proved, evidence-based improvement in physical symptoms from doing that work to negotiate with those parts. So again, I'm not saying all illnesses are related to that, but almost everybody I've ever worked with, if they go in with compassionate curiosity, they find some message that's coming from the body, from the parts, of something that they could begin to change. There's wisdom, there's intuition, there's guidance in the information that we get if we're listening to it from self. So that would be my encouragement to all of you to be curious.
So is it common, you kind of alluded to sometimes there's a correlation between where the problem is, what type of illness it is, perhaps. And is there a correlation between the illness and the parts? For example, if you're having a pain in your foot, well, could that be, oh, that I would look at this part first, or is it just sort of, it could be random?
Yes and no. I don't believe in things like what Louise Hay says. She's like, look it up in a book, and your shoulder pain means, you're carrying the weight of the world's on your shoulders or something. It's almost never that literal, and nobody else can tell you what it means. But there is often a kind of interesting metaphorical relationship between the symptom and the message, right? So I always tell people, don't let anybody, just like nobody else should interpret your dreams, you, anything can be an oracle. We can pick up a pine cone and ask it a question and see if we can hear the answer that we need to hear from a pine cone, right? We can use our bodies as oracles. We can use our dreams as oracles, but don't trust anybody who tries to come in and tell you what your symptom means. But so we always say, go direct, just ask. And the part will tell you. And it's surprising to people. You just need to, again, get other parts aside. You can't think it. It's not cognitive.
What does
So,
that look like when you say go to the part and ask?
I mean, first, again, that's why I said it's easier to show than to explain.
Okay, so
But
all right, so we'll be doing that in a few minutes if you want to hold that off, and we can actually
it
go
takes
through.
longer than I'm already out of time to do that. It takes longer than that. So,
Oh, okay.
um,
So we have 40 minutes left. Is that you don't have enough time to do
no, no,
it?
no. We have 7 minutes left.
Oh, I thought we were doing 90 minutes and then 30 minutes for the audience.
Nope, 60 minutes and then Q&A with the
Oh,
audience.
I'm sorry.
I'm
I didn't
sorry, I'm
realize.
not available after the
No, no
half.
worries, no worries. I
Yeah.
I misunderstood.
No,
Um,
that's all right.
so with that, if anybody in the audience wants to ask any questions, we can open it up with the last 7 minutes. I apologize. I thought we had an additional 30 minutes.
No, that's all right. I wish I could stay longer. I have my book edits are due and I'm also moving, so
I
I don't
I
have the time.
I totally understand.
Yeah. But if anybody is interested in this, I would tell them the best place to get more information about this is to maybe take the 6 Steps to Healing Yourself online program and read Mind Over Medicine. And then I'm actively working with an ongoing community in Love School. So you can find all of that at lissarankin.com.
LissaRankin.com. John, if you
Yeah.
could put
And
that.
we do IFS every session.
All right, great. John, if you could put LissaRankin.com in the chat, that'd be great. So everyone can go there. So you've referred to the placebo effect and in your work as scientific proof of the mind's healing power. How would you explain the placebo effect to somebody unfamiliar with the concept?
Well, I mean, scientifically, the placebo effect comes from clinical research data that began in the 50s and 60s. We used to just give people whatever, snake oil, and people would get better. And we just assumed the snake oil works, right? And then we realized that some people you give snake oil and they get they get better. And some people you give snake oil and they don't get better. So, the idea of evidence-based medicine is still, less than 80 years old. So when clinical research trials with pharmaceuticals began, the goal was we would take a group of people, we'd have a randomized controlled clinical trial, which means we have people getting the new medicine and people not getting the new medicine. They're getting a placebo, they're getting a sugar pill or a saline injection or a fake surgery. Um, and the patient doesn't know which one they're getting, and ideally, the practitioner doesn't know either. So it's double blinded. And we would warn people, if you're getting the medication, here's the potential side effects that you might get from the medication. So let us know if you're having any side effects, right? And here's the potential benefit. We're hoping that these are the benefits that you're going to get. And what we found is that in the people that were getting nothing but a sugar pill or a saline injection, they a percentage of them that ranged from 18 to 80%. The placebo effect on average is about 30%. They would get both the benefits, they would get better, their symptoms would get better, and the nocebo effect means they would also get the side effects. So it was often very confusing for patients and practitioners because the sort of power of suggestion can cause both positive benefits and negative side effects for somebody who's not getting the medication. So I find, both of those really fascinating. At one point, I'd been taking, I was getting desensitization therapies for some really bad seasonal allergies. And so I was getting the sort of allergy shots, and they told me, you'll know that you're desensitized when you give yourself the shot and you no longer get a hive. And I would get huge hives every time. I was doing this for a couple of years. Huge hives every time I injected myself with this medication. So I went to the allergist and I was like, my symptoms are gone. My allergies are much better, but I still get the hive. Like, when can I quit? And she was like, well, you're not desensitized yet. And I was writing Mind Over Medicine. And I decided, you know what? What would happen if I injected myself with saline? And I told myself, this is your allergy shot. You're going to get better. Your allergies are going to continue to stay better. And I injected myself with saline and I got a hive this big. And that was the last day of my allergy shots. Um, so, scientists are mystified by this. There was a huge interdisciplinary conference at Harvard in the 1990s, and there's a wonderful transcript of that conference written by Anne Harrington in a book called The Placebo Effect. And Harvard basically threw its hands up and said, we don't know what to do with this. But I'm particularly, step one in the 6 steps is based on what we know about that. How do we leverage the positive benefits of the placebo effect and minimize the potential negative effects of the nocebo effect, which I think medical hexing is one of those nocebo effects. Like, I tell doctors, one of the first things we do when I'm doing trainings for doctors is I tell them, anytime you come into a patient and you tell them, you have this diagnosis, the prognosis is terrible, you have 3 months to live. You better get your things in order. That is, there are people that have been given that prognosis that died right on schedule who had a totally clean autopsy. That's such a terrifying message for most people, that people can die of fear, of shock, of nervous system dysregulation. So obviously, we don't want to give people false hope, but we also don't want to pretend that we know the future. That's extremely narcissistic. Um, and be realistic, but also ask people how much prognostic data do you want? People can look it up on the internet, that's fine. But just knowing that, you're not a statistic. And so that's why I tell people, I teach them the good way to give bad news. And part of the way that I tell them to do that is, if the diagnosis that you're giving, for example, is a scary one, also give them a case study. If there's any case studies of spontaneous remission, give them a little hope alongside your bad news. So I really, at this point, I had a whole theory about the placebo effect when I wrote the original version of Mind Over Medicine, and I included I now have I have an updated idea. Nobody knows. So it's sort of grandiose of me to even think that I can demystify this very mysterious phenomena. But it's a longer answer, but my current theory is in the updated version of Mind Over Medicine.
Great. And with that, that concludes our Q&A. So thank you so much for your time. It was a lot of really great information, and I know that the audience will be checking out your stuff. I'm seeing some questions and whatnot in the chat. So if we could unmute the audience so they can share their appreciation.
Thank you.
Thank you.
We're getting all the money back.
Connection by stimulating